Hello everyone, this is Dr. Khan, Executive Plastic Surgery. So, very interesting case, silicone implants, one set through the nipple areola complex and below the muscle, relatively very large implant for the patient's chest, but she had a grade 4 capsular contracture on the right and also on the left, which means that it was hard, deformed chest, very tight capsule. And number 2, it was causing her pain. It was a deformity that you could visualize on the chest and also palpate a hard, basically breast implant on the chest. So she had a lot of complaints coming in, and the many symptoms about this breast implant illness. So she gets what is 100% total capsulectomy, 8/13/25, initials LO. Grade 4 capsular contracture, silicone implants again from 07. So as you can see, this is like overall nice and round, even though this was a grade 4. Look at this one on the left. It is basically outpouching here. It is overall kind of contracted. This one is kind of more spread out, and this is again goes to showing you this could still be grade 4 and still be hard deformed and causing the patient's pain. As you can see, I'm very happy and content with how the whole dissection has gone. Complete 100% sincere, honest, total capsulectomy performed. Only the inflamed abnormal tissue removed, and I'm going to cut this open. And as you will see, this is a relatively thin capsule. You can see how thin the capsular tissue is in an intact, smooth implant. A little bit on the yellow side, if you ask me. And so, if you look at this, this is the leaching of the silicone, what I call the gel bleed that's occurring. So, Mentor implant 450, relatively very large, again on the yellow side. And so very thin capsular tissue. You can see my blue glove right underneath. And again, it's all about that complete sincerity when it comes to removal off of the rib. Anyone can remove implants, but it's all about the capsule in my practice. And so she's going to get the best shot, i.e. blood loss was less than 5 cc's each side. Complete total capsule removal right on top of the many ribs. So the grade 4 capsular contracture. I removed a lot more skin on this one because this is where the distance from the nipple down to the crease was a lot more. So that's why I balanced the two out. So as you can see, very thin capsule. Remember, the volume is very precious. This was towards the bottom side. If I touch this field, this is abnormal. But as you can see, I'm very happy and content. Now let's see if this is ruptured or not. Implants that are 3, 13, 18-year-old set of implants. So there you go. And you never know till you go in. And lo and behold, it is ruptured. If I go and so end block, if I take my ruler and I put it right here, see how thin the capsule is? So many surgeons say, well, the capsule is so thin, I left it behind for the patient's own good. Wrong. If I had not done an end block, this would potentially have spilled into the chest. If I had rushed through the surgery, this would have spilled into the chest. If I did not know in my mind that it was going to be ruptured, be it the right or the left, the silicone would have spilled into the chest. If I had not done an end block properly, this would have spilled into the chest. So the surgeon has to go into the case thinking that both the implants are ruptured, or there might be fluid around, or there might be badness on the inside, because you never know what you're going to find till you go inside and cut the capsule open. You do not want to be doing it on a local like you heard yesterday, and you want to do it with the right etiquette such that you are going millimeter by millimeter. Literally, I would say, if I take my sterile marker, it's literally going millimeter by millimeter and removing the capsule off of the rib. This was a very tough case. It was a lot harder than what I expected. And if you have to dissect like this very slowly and tease it off, this surgery is not about speed. I see a lot of surgeons doing an supposed end block and a lift and a fat grafting in 2.5 hours. That's virtually impossible. No matter how thin the capsule is, it has to be removed in this fashion. And the total capsulectomy and end block is the gold standard. Remember, that is the ultimate. 1,000%, no one can deny this, that why did you do an end block? And as you can see, all of this was contained. Now, the other thing I want to mention here is this was the year in 2007 when the implants were introduced as safe, as good as the gummy bear. Look, it disintegrated. And you can see, look how thin this is. You can see my glove. Look at my glove. This is how thin this capsular tissue is. No matter how thin, it is removed in the fashion. And you know, to all those plastic surgeons who say these are still gummy bear, there is nothing gummy about this. There's something certainly gummy about it, but you can see it's starting to turn yellow. And if you ask me from my gut sixth sense, this was on its way to rupturing as well because it's old. So as you can see, all of this is contained. Look at the shell of this implant right here. If I press, that's basically falling out. And you can see this is going to creep into the tissues on the side, and none of this happened. So the word gummy is the wrong term to use in this one, as there's nothing gummy about it. So the implants are not lifetime devices. They certainly need to be monitored. She was scheduled to supposed to be getting her MRI, but she chose not to. And again, this is a very important point to make, that according to the manufacturers, if you look at Mentor, they tell you to get an MRI at year 3, and then every 2 years they're onward. So in her, I'm going to summarize what is the con procedure. She's not going to get a lift. She's too inflamed, great for contracture, a lot of inflammation. Plus, very likely she will not need a lift. No need for drains. The capsules will be going to pathology to rule out that very rare BIALCL CD30 analysis, rule out lymphoma, rule out malignancy. Cultures for aerobic, anaerobic, and fungal. The implants will be returned to the patient, twilight deep sedation, and she's going to get the high definition pictures and videos of not only this Facebook Live which she's going to see on the YouTube Live, but more importantly at the chest wall. So this is the take-home message. Show me the chest wall. That's what every patient must ask their surgeon. Show me the chest wall, high definition pictures and videos, because that's the ultimate proof. And that we will see how she's going to do, and you can only imagine how much better she's going to be minus these toxins. There you have it. This is Dr. Khan, Executive Plastic Surgeon.